commitment on affordable credit was at the heart of the Kenya Kwanza election campaign. Already, expectations are very high across the country on our promise to provide a fund that will offer affordable credit to those at the bottom of the pyramid. I am aware that the most significant question in the streets today, in border parking lots and fresh produce markets, is when will the Hustler Fund become operational? And I want to tell them I have an answer for you today. Even before the fund is set up, we have made several interventions to make credit accessible. Safaricom, and I want to thank them, and their financial partners have brought down the cost of Fuliza by reducing interest rates by 50%. As part of that agreement, 4 million borrowers who had been blacklisted will be freed from the yoke of Credit Reference Bureau in the coming days. We have also secured an agreement with CRBs that they will abandon the punitive penalty of blacklisting borrowers and move to a credit scoring system that makes borrowers eligible for credit even as they work to improve their credit worthiness. As a result, no citizen will be excluded from the credit system. They will therefore be eligible to access credit as they work their way into paying their loans. On the Hustler Fund, there are 3 crucial issues. Credit products will be available under the Hustler Fund to small businesses on digital platforms at affordable rates. Affordable rates being single-digit rates to individuals through chamas, groups, circles, and cooperatives. All borrowers in this platform will not only access affordable credit, but they will also participate in short-term saving plan and long-term pension program. Every saving made by borrowers on this platform will be matched by the government of Kenya on a 2-to-1 ratio to a level to be determined by the program. And I will launch this fund credit and savings product on the 1st of December this year. Health is front and center of socio-economic development. The failure of a health system undermines prosperity. Kenyan families spend a total of 150 billion in out-of-pocket expenditure on health services a year, mobilized from various sources including Harambes, WhatsApp M-Pesa groups, loans, sale of land and other assets to pay hospital bills for loved ones. Also, many small businesses fail when owners fall ill and cannot work or divert money to pay medical expenses. It is no wonder, then, that it is commonly said that most families and individuals in Kenya are one illness away from poverty. 1 million Kenyans sink into poverty every year because of medical expenses. We want to lift, and we must, this punitive burden from the shoulders of Kenyans and their businesses through our universal healthcare plan. The plan is to revitalize primary healthcare by laying more emphasis on preventive and promotive strategies. Many critical health illnesses, including cancer, heart complications, kidney failure, and hypertension, can be detected and addressed at this level without the need for hospital visit or admission. Our health reform commitment is therefore threefold. In partnership with county governments, we will mainstream community health workers and make them the foundation of our health system. Reforming the National Health Insurance Fund is a necessary imperative. Progress has been made in enrolling more members, and in the last 10 years, 12 million Kenyans have joined the fund. The challenge, however, is that the NHIF is an occupational scheme that is tailored for salaried people on payroll in public and private sector, and not the social insurance scheme it ought to be. We shall change the contribution structure from an individual contributory scheme to a household contributory model. We intend to address the challenges of inadequate human resources in our public hospitals and the poor industrial